Hello everyone. Long time no see. I think it's almost a few months, right? I haven't uploaded any videos yet. Firstly, thank you so much for those 5 subscribers. Thank you for your supporting. So recently I'm thinking I should start again to do some to filming some videos because I would like to share some of my experience, including the working experience and life experience. So currently, I'm still working as a dental chair side. It's kind of like a same job as a dental assistant in a dental clinic. So there are a lot of stuff that are going on. And I also learned a lot from the current position. Before I started the working here, to be honest, I totally had no idea what I should do. But just in interview, when they ask what do you think this job, like what this position should do, I guessed it may assist the dentist because it's called assistant, right? We just need to assist the dentist to manage their procedures, the patients, to make sure the work smoothly, everything runs smoothly. So that's what I think before, but actually it's true. The title also just point out what this position should do. Like after I work there almost 6 months now, our main job is to assist the hygienist or the dentist all the day when you are there. So it's including it generally it includes assisting the hygienist generally. So our daily tasks include preparing for the patients, like if they have some hygiene or some procedures, then we need to put the instruments, prepare for the instruments in advance. And then when the patients are there, so except for consultation, generally it's just like the patients and talk with the hygienist or the dentist. So for the consultation, they will have some mostly about talking about sharing the concerning and then the professional advice from the practitioners. So this is different part for consultation, and others like, but for the consultation you also need to prepare for the examining kit because they need to have a look about their teeth or some other part. And then so this is one part. Another big part, like if they need to do the hygiene, do the appliances, need to do some procedures, then you need to prepare a lot of the instruments. And then meanwhile, when the patient come in, when they sit, then you need to pass the instruments to your dentist or to your hygienist. So which means you need to think all the procedures in advance. You need to be one step further and passing the instruments, right? And then when they finish the procedures, they need to do the clean the room, clean the seat, the instrument stuff, and then prep for next one. So when you heard about this, it looks like simple, right? But the most complicated part is you need to, what you've done, have to meet your hygienist's or your dentist's need, because everyone has different behaviors. They have their own habits. Like even in our clinic, just a few hygienists and dentists, everyone is different. So when you go to help assist any others, the instruments you prepare is different, and the procedures maybe like the general process of procedures may same, but they also have different. They are also different as well, because someone will add something, or they will use different the ingredients or instruments. So what? This is to be honest, this is a hard part for me. Oh, okay. Actually, this is not just this part. This is one of the bigger challenge for a dental assistant you need to do, because in general you may not just assist one, because sometimes you may be backup if another assistant call sick, and then they may need you only that day. If you are available, they need to assist others, right? Oh my god. And this is part. Another part is we are very vulnerable. Like our position, because we are assistant, what we do is to assist the hygienist or the dentist. Maybe we could say just the practitioners. We assist the practitioners. So their attitudes, their moods is, to be honest, just in my opinion, are quite important to us. Because if they didn't show any the other attitudes, just like general, I didn't show much about that, it's good. But people are moody, and if you are very experienced and you know them very well, and you can avoid any kind of the tricks there, it'll be excellent, right? But it takes time as well. Like for me, I'm still new. I know my hygienist, she's very nice and supportive, but she's also moody. So the interesting part is my day is really affected a lot by her moody. So if she, I don't know, sometimes if she's a bit down, and I can feel that, I just can feel the vibe, the atmosphere in the room is so cold. So when I'm doing anything in the room, I have to be very cautious. And it's better for me not asking any questions and not making any mistakes. For example, like one day, it's not really making mistakes. It's just in my opinion, because sometimes if we are very busy and something you may not have time to do the day before the working day. So like for example, one day I was asking the hygienist next patient, do they need anything else? What's that about? Because the day before that, I didn't check. It was too busy, as you remember. It was really busy those days. And she said, I think before that, because I had some disagreement with her, so I think she was angry with me. And then when I asked her about this question, in general, it's totally fine. And she often explains to me in advance what we should do next. But that day, when I was asking her, she said, you should check this yesterday, not asking now. Could you check them in advance, please? Oh my God, I got a headache. Even though I'm a woman, I still want to say, woman is really very easy to get moody. Okay, I said, okay, I will then. Because I'm not like a perfectionist. So when I do the job, it's fine. It's just fine. It's not excellent, perfect. And I'm a little bit careless. Sometimes when I do something, I may, forget or put off something. That's really not good. I don't know. Just this year, I found it wasn't my year. I found my shortages. I know them a long time ago. Okay, why I talk about my personality as well. Anyway, so back to the job. I think I said too much and irrelevant stuff there. So back to the job. As a dental assistant, what you have to do is, your many tasks. You should know well of your practitioner. Especially, learn about their habits, what they prefer. So, and what they not prefer. You really should figure out, because your job is to assist them. So you need to follow their habits. And second, you should have the basic. You should have the basic dental knowledge. Like, what's the name of the instruments? By the way, different practitioners, they also have different names, even though it's just the same instrument. They have their preference as well. So you need to understand that part too. And then thirdly, about the procedures. Mostly they're the same. The procedures, mostly they do the same thing. So if you know the process, it'll be much easier for you to pass in the instruments to prepare for it. So except for those parts, there's some some kind of details you need to pay attention. For example, how to place your suction tips. Generally, we will use a low speed and high speed, right? And for low speed, it's fine, even though you couldn't use it very well, but it's like a small suction, so it doesn't affect much. But if you are using the high speed suction tips, it's very easier for you to suction the patient's cheeks or the tongues or any other place, and it also very easily to cause the uncomfortable feelings if you put the high-speed suction tips in a wrong angle. So if you are a beginner, you need to figure out about 4 tips. Okay, that's it. Next time I will share more about the details as a dental assistant. If you would like to know more, subscribe and like it.